more? Am I going to be worried that am I going to be lying awake for the next 2 weeks, hoping that there's no pregnancy for this person, or am I going to be worried? So if I'm going to be worried about this person and having a dangerous pregnancy and lying awake worrying about the couple and hoping that maybe there shouldn't be a pregnancy, then I know the safe-holding thing to do is to just cancel the cycle. Sometimes I would actually convert the cycle to IVF in that case, depending on the situation. From couples it's a little more complicated, but let's say I'm dealing with a couple who's not from, or they're not Jewish or whatever it is, and I see that they're on their way to making 10 eggs with even a very low dose of the injectable medications, then I might say to them, look, we could cancel the cycle and try again next month, or if you want, I can take you to the operating room tomorrow and put you to sleep and take out the eggs and do IVF, because even if you have 10 eggs, it's fine, we're only going to put back in 1 or 2 embryos, so we don't need to worry about the multiple pregnancy issue. So you have to be careful about that. Sometimes it's better to use common sense, and even though it will take a little bit more, even though it will be a little painful to have to do it all over again the next month, sometimes it's better to say that's the smarter thing to do.
Okay, Dr. Levine, there's a question here. What exactly does the HCG trigger shot do?
So the HCG trigger, we didn't talk details about that, but what the HCG trigger injection does 2 important things. So just to explain to anybody who may not be familiar, at the end of the stimulation process, at the end, once you've given all the injections and gotten the follicles and the eggs growing and ready for pregnancy, so ovulation has to happen. And we saw naturally that ovulation happens when that hormone called LH goes up very high, when the body produces LH. When you're treating with injectable medications, the body doesn't produce enough LH. It usually produces some, but often not enough to make the egg actually burst out of the ovary, to make the egg ovulate. So what you do is you give HCG, which is a hormone which has many similarities to LH and does the same thing in the body that LH will do. And that HCG injection is mimicking an LH surge. It's making essentially an LH surge. And what the LH surge does is 2 very important things. First of all, it causes the wall of the follicle to weaken so that it will burst, right? If it's a strong wall, then it won't be able to burst. But if it weakens, if it's thin in a certain area, it will be able to burst just like a balloon that you're thinning out part of the wall. And number 2 is it actually helps inside of the egg. It helps the egg go through its final steps of maturation, which it needs to do in order to fertilize, in order to be able to be met by the sperm, to be able to have fertilization. So those are 2 very, very important things. And I can tell you that if you're doing IVF on somebody, and every doctor who has done IVF has had, Baruch Hashem, on rare occasions, this experience, sometimes from a bad lot of HCG, or from not teaching the couple well enough how to do the HCG, so that something gets messed up in the injection. Whatever it is, on occasion, I've seen where, which is just to illustrate how important the HCG is, if you stimulate the ovaries and you see big follicles that are ready to be taken out, and a person does not take her HCG injection, or the HCG does not get properly into the body, and I take them to the operating room and put a needle into their ovaries, I will not get out a single egg, not a single egg, because the egg is also very tightly attached to the wall of the follicle, and the HCG, as part of the maturation of the egg, also loosens the attachment of the egg to the wall so that it can come out with a needle. Sometimes if a person has not taken HCG, you'll see 15 follicles and not a single egg comes out. So it's a very important injection.
Avidril.
Yes.
Avidril. Is that the HCG?
That is HCG. Okay. Avidril is something called recombinant HCG. Most HCG which is available, the regular HCG, or the generic HCG, or the Navarel or Pregneal or other formulations of that HCG, are actually purified from the urine, because HCG comes out in the urine, so it's purified from the urine. And because of that, it can sometimes be a little bit irritating. If people have done HCG injections, sometimes they'll notice that they get a little red mark around that area, which is all normal and fine, and it goes away. But that's because it has some foreign proteins in it, and it comes from the urine. Very purified, obviously, it's not dangerous in any way, but Avidril is a recombinant HCG, which means that it's produced, it's not isolated from the urine at all, but it's produced actually in culture in the laboratory. So it is HCG, but it's produced specifically, it's designed specifically for this purpose.
Is there any reason to cancel a cycle versus reduction of multiples?
Versus reduction of multiples. So I would probably answer that question yes. deciding to reduce multiple pregnancy is, does everybody, just to explain what that is, there's something called multifetal reduction, which basically means, let's say if a person has a septuplet pregnancy, has 7 fetuses, so the medical technology exists to, and this is not a reproductive endocrinologist who would do this would be a high-risk obstetrician who would do this kind of thing, and not all high-risk obstetricians will do it, but the medical technology exists that when you get to a certain stage in the pregnancy, usually about 10 to 12 weeks of pregnancy, the doctor can actually put a needle into, let's say, 4 or 5, whatever it is, of the hearts of the fetuses and inject a certain chemical which will make the heart stop. So it will basically stop the pregnancy of one of the fetuses or several of the fetuses. This is an extremely complicated halachic issue, which involves issues of rodaif and other kinds of things, which a lot of poskim have discussed, and and the maskanas have been varied. There are many poskim who would allow a fetal reduction for a pregnancy which is a risk to the mother's life, for a pregnancy which is, it's a hard question because every pregnancy to some degree is more of a risk to the woman's life than not being pregnant. There are always risks in pregnancy that you don't have when you're not pregnant, but there's more of a risk in a twin pregnancy than in a singleton pregnancy, and there's more of a risk in a triplet pregnancy than in a twin pregnancy. So where do you draw a line and say, okay, this is a risky pregnancy, we have to do something about this? It's a very complicated question, and because of that, to me, it's very, very much of a di'evet question. It's a question that would need to be addressed by a posek if it happens, but it's so much better to avoid the question altogether. And that's also, of course, aside from the medical risks. So there's definitely a risk of losing a whole pregnancy if you reduce. Generally speaking, the more fetuses that you reduce, the higher the risk of losing the pregnancy. So if a couple has a triplet pregnancy and reduces one of the fetuses to twins, there will be maybe a 5% risk of losing the pregnancy. If you have a pregnancy, a quintuplet pregnancy with 5, and you reduce that to twins, you reduce three fetuses, there will be a much higher risk of pregnancy loss. So there are complicated medical, halachic, emotional, moral issues with it. And if it's a question that ever needs to be addressed, you address it, but if you can avoid addressing it, much, much better to do that. Does that make sense?
Are there any safety concerns with all the injections in terms of, let's say, cancer in the future?
In terms of cancer, not that we know of, basically. There was one study which seemed to show for Clomid a little bit of an increased risk of cancer later on in life for a woman who took Clomid for more than about 12 cycles, more than about a month. There have been other studies which have shown that not to be the case, and even that study didn't show any increased risk of ovarian cancer with using Clomid for less than 12 months. So even that is very, very unclear, very debatable. With injectable medications, there's really nothing that tells us that there is an increased risk of cancer. At the same time, when you're stimulating ovaries like that, you don't know for sure that there's not going to be a risk later on in life. So to me, I think you really have to use these medications with caution. With caution meaning not over and over and over and over again. If it's not working, then you have to try something else. And with caution also means to me, you have to do it for a good reason, for a reason that's going to give you a reasonable chance of a pregnancy. So if I have a couple, for example, who the husband has very, very low counts, for example, so we can try to use these injectable medications with inseminations, but if that doesn't work after a few months and the sperm counts are always really in IVF range, then I'll probably have a discussion with that couple and tell them, I'd rather not do this over and over and over again because I feel like this might not be the right hishtadlus for you. And we've tried it a few times, but I think now it's time to really try to step things up so that we're not using these medications for no good reason. So I think that they're safe to use as long as they're used with common sense and for a good reason.
Is there a higher risk of miscarriage with IVF?
It's a good question. Not that we really know of, and not that we see in the office. The risk of miscarriage, there seems to be a little bit of a higher risk of bleeding in your early IVF pregnancy, but that does not necessarily translate into a risk of miscarriage. Now, every pregnancy has a risk of miscarriage, and the risk of miscarriage could be for anybody as high as about 25%. 1 in every 4, 1 in every 3 even pregnancies can end up as a miscarriage, sometimes so early that we don't even know that person is pregnant. With IVF, you know about all the pregnancies because you see them early on. You're testing from very early on. So that itself can make it feel like there's a higher risk of miscarriage. And with IVF also, the emotion of the miscarriage is magnified. It's almost the opposite or the flip side of Lefum Tzara Agra. The more effort you have to put into something, the greater the devastation when that doesn't work or when something bad happens from it. So, whereas nobody in the world obviously is happy going through a miscarriage, but for some people it's much more emotionally trying than for others, and people who have gone through fertility treatments to become pregnant, to lose the pregnancy or to have the pregnancy not develop properly is much more devastating. So the answer is that there's probably more bleeding in an IVF pregnancy, probably not a higher risk of miscarriage, but you are more aware of all the pregnancies, so it might feel like the risk of miscarriage is higher, and the emotion about the miscarriage is really much more intense.
Can you explain what the HSG test is?
Sure. So an HSG is one of the tests that I mentioned as a test that we can use to look at the inside of the uterus, at the uterine cavity. It stands for hysterosalpingogram. Hystero is the Greek word that relates to uterus, like hysterectomy when a person has their uterus out, for example, or hysteroscopy when we put a video camera in the uterus. And the Greek word for a tube is a salpinx, which means tube. So a hysterosalpingogram is an X-ray of the uterus and the fallopian tubes. What the hysterosalpingogram does is, if you just took an X-ray of the uterus and the fallopian tubes, it would just show up as nothing. You wouldn't see anything, because usually if you take an X-ray of any part of your body, you see the hard parts of the body. If you took an X-ray of your hand, you would see the bones in the hand, but you would not see the soft tissue. You wouldn't see the muscle and the skin and the tendons and the ligaments. The uterus and fallopian tubes are soft tissue, so the radiologists are not able to see those on plain ultrasound, a plain X-ray. So what they need to do is they need to actually put a little bit of a dye, a little liquid, into the uterus, which is a special liquid that is what's called radio-opaque. It shows up as white or black on the X-ray, depending on how they're taking the X-ray. And what they do is they fill up the uterus with this dye, and the dye fills up the inside of the uterus and spills out into the fallopian tubes. And then they can snap an X-ray and they can see that everything looks normal inside of the uterus, that the shape is correct of the uterus, and they can see that there are no blockages in the fallopian tubes. And that's what an HSG is, a hysterosalpingogram. It's an important part of the fertility workup in general. You need to know whether there are any blockages in the fallopian tubes. On the other hand, it's also a very uncomfortable test for anybody who's gone through it. You'll know that the dye, although it's not dangerous in any way, it can cause a lot of very severe cramping inside of the uterus. It feels like very bad menstrual cramps, and because of that, it's usually a test that I would try to avoid at the beginning. If I don't have a real chash that there might be a problem with the fallopian tubes, then I'll avoid that at first and just work on whatever else I can see that might be an issue. But if you really start to worry that maybe there is something going on in the fallopian tubes, or if things are just not working out after trying it for a few months, then you probably do need to do that test. As uncomfortable as it is, it's an important and informative test.
Any other questions?
Someone told me they did an IVF cycle and then developed a hematoma and lost the cycle to it.
You mean lost the pregnancy?
Yeah, the pregnancy. So, is there really nothing to do about hematomas, like when they develop?
There really is not. What you're referring to probably is what's called a retroplacental hematoma,
Yeah.
which is basically a blood clot. Well, it's not so much a blood clot as much as just active bleeding inside of the uterus with a pregnancy. There can be bleeding kind of in between the placenta and the wall of the uterus, and where a little bit of the placenta might separate or might cause some bleeding, and blood can kind of accumulate inside of the uterus. Typically, this retroplacental hematoma, usually it causes heavy bleeding, scarily heavy bleeding, often just a very, very heavy gush of blood in pregnancy when obviously you don't expect it, not associated with cramping. So it's usually what's called silent, heavy bleeding. And a retroplacental hematoma often is okay, meaning pregnancies can continue fine with a hematoma. Usually the hematoma will kind of stop itself. The bleeding will shut itself down, and eventually the body will break down the blood, and it'll go away, and then the pregnancy will continue on its way. Sometimes it can continue to be present, and it can persist even into the second trimester. I've even heard of people continuing to have bleeding really all through their pregnancies from a hematoma, and often does not affect the pregnancy, but just causes, a lot of worry and concern. But unfortunately, sometimes if the hematoma especially gets big enough, it can sometimes start to affect the pregnancy and cause a miscarriage to happen. There is no cure for a retroplacental hematoma, except that if a person who has a hematoma is on some sort of blood thinning medication for a blood clotting problem and is trying to help thin the blood, like aspirin or like injections of heparin or Lovenox or something like that, then I would stop those blood thinning medications when a retroplacental hematoma starts to develop, because you don't want the bleeding to continue. You want to minimize it. There are things that we do that make all of us, doctors, couples, everybody, makes us feel good, but nobody really has proven that they're of any benefit, like going on bed rest, for example. And I always tell people to go on bed rest because I feel like I want to do something. I want to do anything that I can to try to make it go away. People sort of think that maybe bed rest helps. When I said bed rest probably doesn't help in terms of the hematoma, it might sometimes change, meaning if you're lying down, then more blood will kind of accumulate in the bottom of your uterus, and then when you stand up, it might all bleed, and that may make people think that, when I was lying down it was better, when I stood up it's getting worse, when it's not really. But anyway, bed rest is one thing that you could do, although again, it doesn't really work, and taking more progesterone is something that you could do also, which also has never really been proven to do anything. So bottom line, you really just have to kind of stop the blood thinners if that happens for anybody, and just wait and daven and hope and keep on watching and seeing what happens.
Is IVIG recommended?
IVIG is an off the beaten path treatment. It's not been proven to be of any benefit in any situation. It has risks to it, infectious risks of God forbid getting an infection like hepatitis or HIV or whatever it is, and it's really not been proven. It is usually used for people who are really feeling like they're in a desperate situation, where they've had multiple miscarriages, for example, and they've tried so many things and nothing really has worked, and that would probably be a reasonable reason to try using IVIG. But it is definitely very much off the beaten path medical treatment. It's not been proven. It's many people do not believe in it and actually actively feel that it should not be used. There are some people who believe very strongly in it and use it all the time. I tend to feel, my own personal feeling is more towards the people that generally do not use it. I do, again, in real desperate situations, if somebody's had multiple pregnancy losses and there's nothing else that we can find to help with, then I can certainly understand and I can encourage people to pursue something which is off the beaten path. But for the most part, it's probably not something to be considering unless there's a really extreme situation.
What is the IVIG that you were just talking
IVIG, it's
about?
called intravenous immune globulin. It's basically antibodies, which it's given for the purposes of pregnancy loss, and there are theories about pregnancy loss that relate to that are immunologic theories that have to do with the body kind of eating up the pregnancy or attacking the pregnancy. And the idea is that if you give IVIG, if you give these antibodies, that it can block the body's immune system, which is attacking the pregnancy, and hopefully be able to help with the pregnancy to be maintained. That's really what IVIG is.
Thank you, Dr. Levine, again.
Pleasure. My pleasure. Much hatzlacha to everybody, and we will certainly be in touch.